Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Shantel Hebert-Magee. She's a pathologist, and she wrote the Kevin MD article, "During COVID-19, Not Everyone Can Get with the Digital Program." Shantel, welcome to the show.
Thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
I'm a Southern girl, Bayou born and bred, but I'm also the product of consequential policies, federal legislation enacted to uplift communities. And so growing up in the Bayou state of Louisiana, health, education, and opportunity has always been a challenge. And so programmatic efforts such as Head Start, Title I, Medicaid, food stamps were essential to my blue-collar working class household. And so not only did it provide basic provisions, but it also helped to disrupt generational cycles of poverty. And in particular, Kevin, I grew up in Treme. It's an area of New Orleans that's very famous for its Afro-Creole heritage, for second lines and jazz funerals. But it's also an area that is considered to be dangerous, and serendipity uplifted me. As my mama would say, another term for grandmother, she would say, but for God, I wouldn't have gone to college or to medical school. And so I entered academia, and I focused on disparities research. And then I started working with industry for a while, cutting edge technology. But I realized that all the products I was bringing to market never reached my personal village, the people in New Orleans. And so I shifted and segued into policy. So currently I am a minority health strategist, a physician consultant, and a CEO of a small nonprofit.
We are now talking in the third week of August. How is the pandemic affecting Louisiana?
I think that Louisiana still has room for progress. I think that at one point in time, we were the epicenter of the pandemic, but I think that people are on board. We have enacted policies making people having to wear masks in public and in places that they may have exposure. And so I think, akin to the rest of America, we have experienced pain, we have experienced loss of family members, we've experienced loss of wages, and just a loss of normalcy. So I'm hoping that we will turn over a new leaf soon as we get a better handle over the pandemic.
So let's talk about your Kevin MD article, "During COVID-19, Not Everyone Can Get with a Digital Program." Now, for those who haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
Sure, Kevin. So clearly, I could have presented an article with a bunch of empirical data. I could have talked about how the implementation of digital health and telemedicine has impacted rural communities that don't have 5G and broadband access. I could have talked about in urban hubs how people may have smartphones but don't have data. But the fact is that people don't remember statistics. What they remember are stories. So I use my mama's narrative. Her circumstances transcends the various tiers of healthcare. She's elderly, under-resourced, undereducated, digitally illiterate, does not have internet access at home, and ultimately she has been undervalued by this healthcare system. And so the point is that when you have disruptive innovation, right, you bring about new technology, you have to consider all sectors of the population, even those that are marginalized and on the fringes. And oftentimes it's those who are marginalized that actually need the most access. And so I felt, it was time to illuminate this problem, and I'm happy that you gave me the platform.
So go a little bit deeper into your story. So tell me how your grandmother, how is she isolated digitally? How does she access healthcare, especially during the pandemic?
So on March 4th, that's when my grandmother was diagnosed with stage 4 lung cancer in the emergency room. For about 6 months, she had significant weight loss, maybe about a 60-pound weight loss. And she is very autonomous, independent. And even though she's not health literate, she was very wise. She had all her medications written on a list, never missed a doctor's appointment. And so they had screened her for everything. She had a chest x-ray, they didn't see anything. She had a colonoscopy. She had a mammography exam done. And so ultimately, after becoming extremely fatigued, we brought her to the emergency room because we knew something was wrong. And so they wound up doing imaging and revealed a 19-centimeter mass. And they kept her for a few days in order to stabilize her. And she was discharged with paperwork. And she was like, I'm so excited. The doctor's coming over to the house. And I was confused. I was like, huh? And she's like, yeah, right here. It says doctor visit, a virtual visit. So virtual, digital was not part of her lexicon. And when they explained it to her in the hospital, they didn't, say that it meant using some computer interface. So she thought when they said that she would have a visit at home, it meant a home visit. And I had to clarify to her that that's not what it meant. So she never had a smartphone. The most she's ever had was been a flip phone, the kind that had the big buttons for elderly people. And she didn't even own that anymore. There was no internet access. And so I found myself amidst this pandemic trying to wear multiple hats, including being there for her appointments in order to navigate the system. But more importantly, it wasn't just my grandmother. Even when we first tried to log in, Kevin, the server was so busy, we couldn't even utilize the app. And then they say, call the tech line. And we called the tech line and we couldn't get anyone. We were on hold for 30 minutes. And I was so afraid about her missing this oncology appointment. So the point is that when you implement this type of technology, there have to be safeguards, particularly for those who are most vulnerable. Because even being a physician, I had difficulty trying to use the app. And ultimately, for the first visit, we used FaceTime, the physician and I. And my grandmother heard him speaking to her, and she thought it was like a video recording. She didn't realize he could see her. And I think what I didn't speak about in the article was that there are privacy issues when you're using these digital interfaces, right? There's third parties. You can see into the patient's home. And while that can be good in certain ways, I wonder, will it further foster implicit bias? And so I just really wanted to illuminate the issue and have practitioners start to think and realize that they have to screen patients before automatically shifting them to a modality that they may not necessarily be prepared to use.
Now, is this situation with your grandmother, is that common across the state of Louisiana? Like, what is the digital literacy landscape like in Louisiana, and what is internet access like?
Yeah, I would say in the South in general, we have low literacy rates. I mean, education is not a platform. Louisiana has consistently for years ranked 49th and 50th in the country when it comes to education. I think that you do have people that know how to use certain things like Facebook, or they know how to use Instagram, but they are not health literate. And then you compound that with digital literacy, having to use an application. I don't think that certain sectors of the population are familiar with it. We know the data says that elderly people, particularly those of color, are even more vulnerable for a multitude of reasons. And so I think when it comes to the landscape of Louisiana, that is something that is significant. Even when it comes to rural access, we have pockets where we don't have broadband. And Louisiana also has the worst health metrics. So, I mean, we have diabetes and obesity and maternal mortality, and these issues are real. And so when you try to segue and try to shift something, you have to consider the impact it's going to have, particularly on those communities that are most vulnerable.
What's the solution here? Because on one hand, during a pandemic, you don't necessarily want the elderly to come to healthcare settings for routine visits. But on the other hand, you have the issues that you talked about regarding the digital health literacy and the lack of broadband access. What's the answer here?
Well, I think it's going to take a long-term plan. I don't think we have a short-term solution. Some of the things that have been happening is that I think hospitals have readily realized, as there have been a number of articles that have come out to address the bias in utilizing this technology. I think that some are now educating, and they're doing screening process to see if a patient will qualify to use digital modality. I think also recognizing that you need to have advocates. And so for me, I wind up being a caregiver who was able to provide my grandmother with the assistance that she needed at home in order to be able to use digital health. I think in addition, we recognize that we need for industry and companies to be able to provide broadband access. And I think, the mayor and the governor in many states have been trying to address this by not only for the healthcare, but also in the educational sector, because these same issues overlie in their families who don't have tablets and computers at home for their kids who are in elementary school, and they need access as well. So I think we're trying to close the gaps, and the issues are being addressed. I think the other issue that should be addressed is when it comes to fraud, waste, and abuse. The vulnerable, particularly the elderly, are most likely to be victimized by fraud. I mean, even when I receive a bill, it says, from the insurer, this is not a bill. And they say, this is how much your cost of your care was. And then you receive a separate bill. But I don't know if I've been upcoded. I don't know if it was the proper charge. I don't know if the application is actually protected from a third party. And so I think these are things that have to be addressed, and it will require probably congressional action. I think what the government wanted to do was to create an avenue for people to have access and mitigate their risk of exposure. But I think before we keep this as a way to have a long-term solution, we have to weed out some of the kinks, and that includes privacy issues. It includes making sure that patients truly do have access and understanding of what's being transmitted.
We're talking to Shantel Hebert-Magee. She's a pathologist, and she wrote the Kevin MD article, During COVID-19, Not Everyone Can Get with the Digital Program. Shantel, for the other clinicians who may be listening to this podcast, do you have any advice for them as they see patients virtually, or they're discharging elderly patients to hospital with need for potential digital follow-up?
One of the things is that I realize as a short-term solution for patients who do not have digital capabilities, they're using the telephone. And I want them to be cautious with that, because even though you can charge and code for that, that is not the same as having a visual inspection of the patient. We get so much from the physical exam by looking at someone, and particularly for those who have substance use and behavioral health issues, you have to have that eye-to-eye contact. And oftentimes, as mentioned before, those are the ones that are most vulnerable, and they don't have a digital interface. So even if you're temporarily using a telephone as a mechanism, I don't want that to be permanently adopted or consider a substitute for actually laying eyes on the patient and getting a comprehensive, or having a comprehensive approach to medicine.
And my final question, do you have a take-home message that you want to share with the Kevin MD audience?
We have to be scrupulous as we honor our patients. And healthcare is a reflection of society. And as healthcare mirrors society, it is now a time for atonement. And we recognize that there are biases and injustices that exist in healthcare that have to be addressed. And so I would ask for every clinician, ally health worker, even layperson, when you see someone across from you, don't just look at them as a medical record number. Don't just look at them as a customer. See them as a person, and look at them through the lens of which you think they see themselves.
Well, thank you so much for sharing your time and insight. Thanks again for being on the show.
Okay, thank you.